Okay, so I'm really excited about this next session, and I know I've said that I'm excited pretty much about every session, but I have a personal connection to this next one. So this is my husband, and this is his friend Heath Adams that are coming up. Sorry, my husband's name is J.R. Johnson. But their topic is really cool, and it's something different, right? We talk about advocacy, we talk about patients, but let's talk about you as an advocate and how to protect yourself, and you protecting your patients. So this is a talk on security and personal security. So they might scare you guys just a little bit with what they can do, but keep me in mind while they're talking because I live with this, okay? Just as a favor. All right, guys, come on up.
All right, guys. So they saved the best for last. This is going to be very different than anything you've heard this entire 2 days. But first, just want to start off by saying thank you to the Summit for having us here. Thank you to my wife and everybody else that organized this whole thing that went off so well. So, round of applause.
Yeah, thank you.
We're going to talk about information security. So we're going to talk about cybersecurity and what that means to you guys, how you can be more secure in your everyday lives, and how that makes your employers more secure. And we're going to talk about it in the context of our experiences with work and how that translates to you guys ultimately, the end users, the patients, their patient data that's protected by these organizations. We're going to talk through our experiences hacking hospitals and what that means.
Yeah, so that's JR. Thank you for the introduction. My name's Heath Adams. I am the CEO of TCM Security. I am known online as the Cyber Mentor, so if you want to go follow me or add me or at me on any social media platform, that's my handle. I do what's called ethical hacking, and we'll get into terminology and all that. Also am on the training side of things, so we train people. We're advocates in the educational space, so we try to make security education affordable, if not free, a lot of the times, and just trying to get more people aware and cautious about what's out there for you, as you're going to see some of the scary stuff we put out there. But
yeah. And I already got my introduction. I'm J.R. Johnson, but I'm a founder and principal security engineer with Triaxiom Security. So we talked to a lot of you guys at the booth over the past couple days back in the back corner over there. And we do very similar work. So we've been colleagues, we've been friends for a long time. We both own companies that are in the security testing space. He's somewhat more on the training side than we are. We do compliance audits, security testing, but we both work for a lot of healthcare organizations. And so that's kind of the intersection of where we come into play here. And this is kind of what we're going to try and tie together is what we see from a security perspective and how that affects healthcare ultimately. So a couple things we're going to talk about. We're going to talk about terminology so we can all get on the same page and so you guys kind of understand what we're talking about, so you can understand what's presented in the news, for example, a lot of the terms they throw around. We're going to talk about our experiences over the past year hacking into hospitals and how we're able to do that and what their effective level of security is. And then we're ultimately going to tie it all in with how you can help. So this is not a technical talk for IT teams at hospitals and what they need to do to secure their networks. There's a lot of work to be done there, but that's not this audience. So what we want to do is talk to the everyday individual and how you can protect your own identities, your bank accounts, your online presence every day, and then bring that into the office, and that ultimately helps your employers. So talking about some of that terminology. Information security is the broad term that kind of covers what we do. And it comes down to literally protecting sensitive data. So that's physical security, making sure somebody can't break into a building and steal the records. That's cybersecurity, making sure that somebody can't break into a network and steal those same records. And it's kind of all under that umbrella. And the way that we fit into that picture, there's a lot of people in information security, but we do what's called penetration testing, which is a funny name, I'll admit. But it's basically, we are hacking into networks before the bad guys can, right? So we get paid to emulate the bad guys, break into a network, and then tell people how we did it so they can fix it. And we haven't done our job unless they fix what we find and to prevent actual bad guys from getting in. So we're working to protect that data by doing what the bad guys do, making sure they can't actually do it. One of the other things that you see thrown around a lot, especially lately, is the term social engineering. So we're going to talk about some of social engineering and how that fits into attacks. But basically, this is where the bad guys aren't necessarily hacking into a network or a system. This is where they're hacking you, the person. This is where they're using psychological tactics to either get you to divulge sensitive information, get you to do something you otherwise wouldn't. So maybe going and entering in your login credentials on a sketchy site. Maybe that's opening up an attachment from an email on your computer. Whatever that looks like, all that falls under social engineering, and there's other terms, and which again, admittedly sound very funny: phishing, vishing, and smishing, which is my personal favorite. Phishing, excuse me, is email-based social engineering. So this is what you guys get on a daily basis, I'm sure. This is where you get an email saying that you've just won a $100 Amazon gift card. All you need to do is go log into Amazon to get it. Or you have this invoice outstanding with UPS. You just need to open this attachment and view it to see how much money you owe UPS. That's email-based social engineering. Vishing is voice-based social engineering, which is not what a lot of people think of when they think social engineering. This is where you're actually calling people and getting them to do something. Extremely successful, extremely advanced tactics that do happen on a regular basis. And smishing is somewhat new, and it's kind of a silly word, but it's basically for text-based, SMS-based phishing. So I literally just got a text before we came on stage telling me that I was the lucky winner of an iTunes gift card and giving me a link that I needed to go visit. That is also social engineering. So ultimately, why should you care about any of this, right? What does this have to do with you guys ultimately? And it's important to understand the aspects of information security that relate to you. It's going to help you avoid risky behaviors, help you avoid being the victim of an attack. And then if you can avoid being the victim of an attack, that may ultimately save your organization as well from ransomware, from some of the other scary statistics that we'll talk about. And if you're more secure in your everyday lives, ultimately everybody wins. So what is the state of security in healthcare? Most people, and we've had some conversations where people say, well, if my information at a hospital, that should be pretty secure, right? Is that more or less secure than an individual private practice provider? Is that, our EHR records are in the cloud. Is that a good thing or a bad thing? Well, ultimately, across healthcare in general, and this is all based on a study from 2019, so the numbers are probably not entirely accurate, but it gives you a good picture because this is still happening today. 16% of healthcare providers report either not having a security program or not having a fully functional security program, we'll call it. And 43% admitted that they are either still developing a security program or have not developed one at all. And so these are the people that are holding some of the most valuable data to attackers, right? So patient data is extremely valuable. It can be used in Medicare fraud, has a high value on the black market where these things get sold. So, that's just a problem in and of itself. But then when you go down to the last line there and understand that healthcare is the highest number of attacks of ransomware over any other industry. And because of that, patient data is being affected from both an availability standpoint, so hospitals are having to shut their doors for periods of time because they can't access patient records. They're having to fall back to paper charts and things like that. It's just the confidentiality of that information at the same time as well. If the attacker has the ability to launch ransomware and to encrypt those files, they also have the ability to just steal them and sell them, and that's happening a lot as well. And phishing, that we just talked about, is the most common point of entry for things like ransomware attacks. And then ultimately, the cost is what drives organizations to change, right? So a lot of times, unfortunately, we don't see security programs successfully implemented or any meaningful changes made until there is a successful attack or a breach of some kind, because it really hurts. For healthcare organizations, hospital systems, the average is $3.62 million. A lot of times, it's much higher than that. That's costs for recovery efforts. That's costs for lawyers and legal fees, communication fees, PR, everything down to HHS, Health and Human Services violations, and paying those fines as well. And ultimately, 89% of healthcare organizations state that they had patient data lost or stolen in the past 2 years. That's a really high percentage. So again, this is a little bit skewed because of the sample size from a survey, but still, we see these attacks going on every day. I know in both of our experiences that we're going to talk about in just a second, it is scary easy. So we understand why these things are happening.
All right, so story time, which is, I think, why we're here. So for hacking, most of it is the user side of things. Yeah, there's a lot that companies can do to enforce the user to do it, but at the end of the day, it's the user who's making these these mistakes. There's a lot of education that could still be out there and be presented. And you're going to see some of that, I think, with the passwords that we see most common. And we take the easy route. As humans, we're flawed. If you give us an 8-character password, we're going to make the easiest 8-character password we can remember. And that really works out for us more than it does the end user. So what we do in hacking a lot of times, especially on what's called external attacks, where we're trying to break into an organization, we are going out and we're doing 2 different things. One is called password spraying, which we're going to talk about here. The other one's called credential stuffing. So we'll start with credential stuffing. We'll go back to password spraying. If you've ever been a part of a data breach, which 99% of you probably have, your password is online. Your email is online. Possibly your address, your name, any kind of critical information is out there, and we can access that. And in fact, if you come see me after, I will look up your email address or anything and tell you what I can see about you, and that way you know. We were doing some of this yesterday. People we were talking to, their passwords were still the passwords that were in these databases. So we can go out, take these usernames, take these email addresses, take these passwords, and just go spray them or stuff them is what you call it, and try to log into networks. Other side of that is, okay, well, we can also do something called password spraying, where we take an organization. If you've got 100 people, we go find the usernames, we go find the email addresses for these people, and we'll take that and we'll say, okay, password 1, summer 2021, September 2021, exclamation, company name 1. Take those just real easy, guessable passwords and just spray. And chances are we're going to find 1 that logs in. That's all it takes is a 1 to get in. Once we're in, now we have access to your email. We're seeing social security numbers, all kinds of medical records, data. We can get on your network. We can get onto advanced phishing attacks, make it look like it's coming from you because it is. Steal
grab
money.
The lists of
everything.
Other users and things
grab
like
everything.
That, yeah.
It's just a whole big data leak, and all it takes is 1 point of failure for that to happen. So it's and this is something that we do. So in the last 3 hospitals, he's going to go over 1, but out of 2 of the last 3, we got in just doing this. Literally going online, looking at your LinkedIn, finding out basic information that's public, and just trying a password. Getting in, going, dumping more records.
And getting in is really, this is the path of least resistance for
Yes.
attackers, because we only need to find the weakest link.
That's
so
it.
It's not about getting access to your admin's account or to something that may be a little
Right.
bit more protected. It's the weakest link, right?
Yeah, and it's these little things that you can do to make our life a lot more difficult. And we'll talk about that, but like having strong passwords really, really annoys me. Like,
Yeah.
So
you want to make our lives more difficult.
Make our life
So-
more difficult. Pass it off to you for campaign.
Yeah, and I'll take this. That's just the middle button. Yeah. Okay.
Yep.
So he just talked about what worked for. So we're in the context of basically over the course of the past year, we've done assessments for 3 different major hospital systems, and 2 of those assessments got in using password spraying, basically. But this is all under a day. So we're talking hours it took us to gain access, gain full control of an entire hospital system network. And so you think about, if we can do it, attackers can certainly do it. And with this is all in the context of obviously those hospital systems are specifically paying us and asking us to do this. So that's why we are the good guys, and letting them know how to fix these things. But it's hard for them to fix these things, and it takes time. Beyond password spraying, one of the other ways that we do this is through social engineering campaigns. And so I'm going to walk through basically an example campaign, obviously not using any of the specific targets that we've done in the past, but looking at what this looks like 90% of the time for when we're successful at these types of attacks. Basically, when we're doing things for password spraying, when we're doing things for social engineering, we're gathering information called open source intelligence, so from LinkedIn, from other sources online. We're taking that information and we're using it to craft a pretext or something that we're posing to be or ask somebody to do. And then we're combining that, usually with a phone call and a spear phishing email, so a specifically targeted email at an individual. And in this case, we're getting them to log into a spoofed website. So all I'm asking them to do is click on this link and enter their credentials. Very little resistance from the user's perspective. And assuming I can convince them it's a very quick action that they don't have a lot of time to think about. Once they enter in their credentials, everything looks legit about the website. I've copied a completely normal website that I'd normally be logging into. I have their username and password. That's all it takes. And so then I go take those things, and just like the password spray, I'm logging into email, I'm logging into the VPN, internal network applications, EHR applications in some case, anything. And so let's walk through what this looks like in one example. So I chose Atrium Health. We're from Charlotte, so that's a big health system in our area. And this is not in the context of any actual social engineering campaign. I just walked through what I would do using publicly available information completely. So starting off with just a Google search, I can see here that they have atriumhealth.org. So that's kind of where I'm going to start, just see what they've got available online. I see things like this all the time, where Atrium Health provides this for their employees, so they have all their login portals in one place. But because they're providing this for their employees, I also have access to this. So I see great targets here for things that I can clone to get them to try and log into, things that are publicly available again. This is what one of those login portals looks like. So this is a perfect example of something that's very simple. I can clone this using automated open source tools to make a website that I control that looks exactly like what you see on the screen here. So then, all I need to do is find a target and send them an email. Finding targets is easier than it's ever been before with LinkedIn. Right here, I go to Atrium Health. I see that they have almost 7,000 employees on LinkedIn, and I have 7,000 different options of people that I can target with this attack. Just, again, we're talking a matter of minutes here. So from this list, I see names, and I can figure out generally what their email address pattern is, first.last, first initial last name, whatever, at atriumhealth.org. There's also automated tools that'll help fix this process, so it's extremely fast for us. And then I want to go buy a domain. So I have that cloned website, but I can't use the literal atriumhealth.org domain because I don't own that. But what I can do is buy a domain that's extremely similar in order to trick people that they don't know the differences in domains. So just because somebody owns atriumhealth.org does not mean they own atriumhealth.com, atriumhealth.biz, atriumhealth.health. There's all kinds of different what's called TLDs, top-level domains, which is that last little piece of the URL after the dot. And when I do this, it's, what, $15 a year for atriumhealth.biz? That's all it costs me. The rest of this is all open source. I buy this for $15, and I now have a website that looks exactly like this, but it says atriumhealth.biz. It's got the little lock in the top corner because I made my own certificate for it. It's got the login screen right here, and all of their branding and logos because it's on their website. I just scraped it right off. And then to tie it all together, I need a pretext or a phishing email to get them to do what I want them to do. So in general, this looks like something like this. Just as an example, in some cases, we ask them to go check the IT inventory, I think is what we used here. In some cases, we say we've stood up a new training portal and you need to go log in and complete this computer-based training. In some cases, we say that we have your password from a dehash or from a publicly available breach and tell them to go look and see what other passwords we have of theirs. There are extremely compelling things that we can use to get you to go do this quickly because there's urgency behind it. We're asking you, like in this, we have a deadline where your computer is going to be disconnected from the network. So we have that psychological urgency. We have information about you a lot of times, your name, your title, where you work physically, just from LinkedIn, but we can tie that all in the email so you're kind of put at ease immediately. And then what it all comes down to is just getting you to click that link. So again, like I said, if you read this email, you might do it without me calling you. Maybe I'll call you up as well if I can find your phone number online and ask you to do it really nicely because I'm Jeff from IT and I just need you to do this real quick for me. And people, again, they want to be helpful. They want to, you don't think about these things in the context of an attack or what it can mean for your organization. So, and that all comes down to the unique challenges of healthcare.
Yeah, so healthcare has some definite unique challenges. Thank you. We see a lot of the small, mid-sized organizations don't have IT, and that goes back to the percentages he was throwing out there. It was only 16% of healthcare organizations have fully functional security programs. So when you don't have dedicated IT resources and you have maybe one person running the show, there's going to be a lot of overlap or things that are missed from a security standpoint, and maybe there's just not enough funding or money to do that as well. And when they do, it's usually, if they do have the funding, it usually doesn't go into they don't prioritize it in the ways that they should, I think. With that, I think there's, on this slide, yeah, so we also have issues with the medical manufacturers having like 20-year-old, 30-year-old equipment that's really, really expensive, and you're not going to replace it just because the operating system's out of date. Works out really well for us because we can go in, we can take advantage of that because if it's 20 years old, 30 years old, likely has some pretty bad bugs involved with it. So patching is hard to do, and also time is money in healthcare, right? So somebody was tweeting at me this morning, I don't know if they're here, but they're telling me like, 1 second delay can lead up to a 45-minute patient delay in one day for logging into IT. So like, if you add 1 second to a doctor's time, that could be the difference between an extra patient in a day. Because of that, maybe we don't recommend strong passwords for doctors. Maybe they use smart cards or PINs, and the security around healthcare changes a little bit based on those types of situations and those thought processes. So there are some, I guess, unique things that are in play, but what you can do is take what we're about to recommend to you here and put it in play for yourself. Protect your organization, protect your patients, and you will be helping out your company and those people as well. Maybe? All right.
Yeah, so it comes down to some key concepts. We're going to cover some really quick, easy, high-level things, and it's easy for us to sit here and talk about them up here. Some of these are a little bit more challenging to implement, but I promise you the ROI on these from a security perspective is huge. And so it comes down to a couple things. So choose strong passphrases, excuse me. Passwords, passphrases, it's a small turn of phrase there where we're not saying passwords, we're saying passphrases, because what we recommend is long, strong phrases, like sentences you would use. And we'll talk through some strategies for choosing those in a second. Enabling multi-factor authentication, where you have to log in with a username and password, as well as a push notification to your phone, for example, an authenticator token that some of your organizations might give to you and use, an authenticator app on your phone, an SMS message even, an email even, anything that is some step beyond what just the username and password is better than nothing. Using a password manager, which we're going to talk about, and then being aware of those types of social engineering attacks that you can fall victim to. So, this is a hilarious video that Heath found, and it's just going to talk a little bit about how most people create passwords, and we'll see from your reactions if it's accurate.
And at the beginning, we all had one password. It was our first password we can nostalgically remember, and we used it for everything. Every time we joined another business, can I have your password? Yes, you can. That is my special word.
Yeah. So that was hilarious. It cracked me up. I can't believe I hadn't seen that until we talked about putting this talk together. But so true. So, and that exactly is the psychological underpinnings of why we are so successful with things like password spraying. So you guys don't think about it when you're choosing a password, but we get millions of options from people that we can target, and it only has to take one. And I can promise you that in the past year, we've had many, many engagements where password 1, spring 2021, summer 2021.
Somebody's password in here is summer 2021.
Guaranteed.
Yeah.
So ultimately, it comes down to this, right? So we say passwords versus passphrases, but it all comes down to length. So this is all a mathematical problem, right? When we are guessing a password, we're using statistical probabilities, but we can only guess a certain number of passwords in a period of time. It's just physically impossible to do it any quicker than that because of a network connection from point A to point B. In other types of attacks, we can do them much faster because we have those passwords offline, but that's a whole nother technical discussion. It ultimately comes down to one key point, that length makes your passwords exponentially stronger, whereas complexity makes them linearly stronger. Right? So if you add a special character, you might increase the key space, but when you add length to it, you're increasing the exponential strength of the password. And when you're choosing those passwords, length is great, but you also need to not base it off of a dictionary word or proper noun of any kind. The reason for that is we don't just blindly guess any character in the English language. We're using dictionaries to do these things, right? So we're using a base dictionary, maybe all the first names in the United States, right? So a lot of people use their child's name and their birthday afterwards. So we use a list of all the names, and then we add the numbers afterwards to emulate like a birthday. That's much quicker than doing a brute force of 8 characters. It's not very effective. So we use these little things that make it easier and make it possible to guess passwords, whereas otherwise it wouldn't be possible. When you combine words together and make a long sentence, the difficulty in us being able to guess that or technically crack it it becomes impossible extremely quickly.
Yes.
We're talking about billions of guesses a second, but when you have multiple words combined in a sentence, after about 4 words, it gets technically impossible for us to crack that. So for you guys, you're still remembering something that's personal to you maybe when you're using a sentence. I have a yellow dog named Spot. Perfect. Everybody knows their dog's name. way better to do that in just that sentence that I said right there, spaces, maybe a period at the end, than just the word spot 21. You know, using those little things where you maybe remember the same thing, you're triggered off the same thing, but it makes it feasible for you to remember it, makes it much more difficult for us. And this is just kind of a classic cartoon that displays this. Not nearly as funny following up that video, but the key here is that, you know, we've gotten really good at making passwords difficult to make and remember. But we have not gotten any better at making them stronger by doing that. And so switching to a passphrase and using length in an intelligent way, using sentences, is what ultimately makes things better. So that brings us to multi-factor authentication. And it's a complicated word phrase that really has a simple meaning. And again, it's just using more than just a username and password to authenticate your identity. So you're using something you know, which is your password, along with something you have, like your phone, or something you are, like your fingerprint or your Face ID in some cases, to authenticate you. And so it's stronger. If I get your password, I still don't have your physical phone. Now, there's ways that we can get around that, but you're raising the bar significantly. And not to say that people still don't approve push notifications when we do things like that. It happens, but it makes it much more difficult and mitigates the risk of credential stuffing and mitigates the risk of password attacks and password sparing attacks. And it's becoming so quick to implement and easy to use. Almost all banks now, I think at this point, are supporting it. You know, loans, insurance, all these things that know they have sensitive data are starting to catch on board and use this stuff. And then password managers. So basically, all these things are great, right? We're telling you how to create strong passwords, but if you use the same password across every site, you're still going to have a problem. And yeah, everybody in this room at some point has shared passwords across sites. It's hard to, you can't physically remember 50 different passwords, 100 different passwords. I don't know how many it is now. It's ridiculous. So you use technology to help you out with this problem. Password Manager is a piece of software that you can use to store all of your passwords in a secure way. This is not your browser. So this is not clicking save in Internet Explorer or Chrome or Firefox. Don't do that. We can talk about that more if we need to, but that's not a good way to store them. Using a password manager separates that. So they're encrypted separately. They have a separate password. So that one password to your password manager is the only password you need to remember. Companies like Bitwarden, companies like LastPass, 1Password, all of these are different options that you can use to store your passwords in a password manager, protect them with one really strong password, probably multi-factor authentication on that as well, and then you don't have to remember any of those passwords. Put a gun to my head, I could not tell you the password to my bank account. I just don't know it. But when I go to log into my bank account, I can grab it from the password manager. Easy as that. It is difficult to set these things up. I mean, it's time consuming. It's not difficult, it's time consuming.
You just have to go change
every
every single password.
Like, what would you say as you're going through that? I mean, you have to basically change every single password as you go do it.
Yeah.
But at the end of the day, then you no longer have to do that again, theoretically. Yeah. We can share passwords securely. So I no longer have to text my wife a password. We share a LastPass account. I can send her the password through that. If I die tomorrow, knock on wood, she has access to all my passwords in my password manager as my emergency contact. None of that gets lost. So there's a lot of really great advantages to this beyond just not sharing passwords across the same site, whereas what Heath said with credential stuffing then becomes a very, very big problem. And then finally, resisting, and we're a little bit over time, but just to wrap us up here, resisting social engineering. So don't open or respond to strange or unexpected emails. Our whole goal with doing social engineering campaigns for companies is to get their employees to, raise their ears just a little bit, just to stop and question for just a second when they're getting something that seems off or seems too good to be true. If you're not expecting to win a gift card and like, oh, I didn't enter this, but I guess it's my lucky day, maybe just think twice, maybe don't do that. In general, don't provide sensitive information to anyone over the phone or via email. A lot of things that you don't think is sensitive necessarily, just by calling and asking the front desk, for example, they could tell me, oh, yeah, sorry, Mr. Smith's not here. He's on vacation to the Bahamas for 2 weeks, so he'll be back in 2 weeks. That's a lot of information that you just kind of slightly divulged, and maybe I want to go break into Mr. Smith's house, or maybe I'm going to use him as the target for a social engineering attack now, because I know he's probably on a beach drinking somewhere. Who knows? Don't download or execute programs that you get via email. So a lot of times if you're not expecting to receive a program, it can do really bad things really quickly. We didn't cover some of the other social engineering attacks we do, but a lot of times it's a macro-enabled Word document where you can actually execute code on a person's computer when they open that document. Very quick and easy to set up. All you have to do when you open a Word document is you see that little banner at the top where it says Enable Macros. As soon as you touch that, the code executes underneath. You don't see anything, but we now have remote control to your computer. So little tiny things like that where it's just training, right? You guys, nobody would know that in their normal everyday lives. But by that one simple step, that enables us to do this entire attack path. And then ultimately, just ask somebody if it seems off. Go talk to your coworker or your boss. Just asking a friend sometimes will like make you stop and slow down a little bit and think about it and say like, wait, as I was just describing that to you, that really didn't sound like a good idea. I probably shouldn't do that.
Questions?
Yeah. Hold on, microphone.
This completely changed my mind, and I'm gonna step aside and change all of my passwords because everything you said, 2021, I'm not gonna tell you exactly what I put before 2021, but everything has 2021. Aside from that, I'm a huge Chrome user because it makes my life easy. So with Chrome, it asks you to save your passwords. How effective and safe is it to trust
Not
Google?
at all.
Don't do that.
Not at all.
Yeah. you
We
don't
can
take
see
this
them.
one.
Yeah, if we get access to your computer, we can dump those in clear text. We can read them. So you could have the world's longest, strongest password, and still we'll be able to see it.
Yeah.
So don't store it in a browser. If you're going to store it in something like the LastPass or Bitwarden, one of those password managers. Go delete all of that data out of Chrome. Yeah.
Okay.
The problem is from a technical standpoint, not to get too deep into it, but
Yeah.
the LastPass, that program encrypts it separately. And when I am logged in, if I get access to your computer as you, it's decrypted because that's how you read it from there, right? So like it doesn't separate the security from your normal everyday use, basically.
Got it.
Yeah.
Thanks.
Oh, yep. But, I mean, who else needs to change some passwords? Because I need to change every single password. Raise your
See,
hand.
If we've done that, then we've done our job by
Yeah.
being up here. So that's good. That's a good thing. Yeah.
So follow up to that question, what about when Apple asks to save your passwords on your phone? Is that safe?
That's the same concept, but I'll say that's a little bit better just in the sense that like we're not really getting access to iPhones. There's reasons for that, but like it's very expensive and technically infeasible to get access on an iPhone most times.
That would have to be a physical compromise of your phone.
Right.
Okay.
If you lost your phone then yeah, all those things would be
Yeah.
there, but
And again, that's where unless they're doing password managing there, that's where even a Bitwarden LastPass will be on your phone. You still have to put the password in to get to that encrypted database. On your phone, if they know your PIN or you got your fingerprint or however they do it,
Yeah.
then in that instance, they have all of your passwords immediately. So it's another layer of protection.
and with the password managers, they're accessible everywhere. So there's browser extensions that take the place of Chrome, where it's actually in your browser. It does that exact same functionality, where it just asks you to save it as you go and log in. It'll pre-populate it when you log into a site, just like Chrome does. It just takes better care of it in the meantime. And then with your phone, there's also apps that do the same thing, where it protects those passwords in a separate, isolated vault, but it's still accessible to you on your phone. So if I need to log into my bank on an app right now, I can do that because I still have LastPass on my phone.
Okay, I have two piggyback questions.
Sure.
To piggyback off of hers, do you think that Android has similar security to Apple, or do we need to be more careful with Android phones?
That's a loaded question.
Yeah. So for the end user experience that doesn't have security awareness, I would say an Apple's the way to go. There is some danger, I would say, in having an Android phone in the sense that it's a lot easier to root these phones, or you can download malicious files and run them.
Yeah.
Where on Apple, everything's very much locked down. You have to go through crazy steps to get around that.
Yeah.
So yeah, from an end user experience, like I think Android's fine as long as you're not going out and getting social engineered, and that's the problem. So if you're aware and like conscious of the phone or conscious of your security, your personal security, then they're fine to have.
Yeah, and just to add to that just a little bit, with Apple, it's a closed environment, right? So they don't have, their operating system's not open source, so there's a little bit more mystery around it. It's a little bit more difficult to develop exploits, very expensive to develop exploits, so they're just not very prevalent, whereas Androids have a boatload more exploits to deal with because their operating systems are open source. Anybody can go read and review that code online. And the App Store process is very different too, right? So if you're trying to get an app on Apple's App Store, there's a very, very robust review process. And Google does have that same thing with the Play Store. It's just not quite as effective, I'll say. Yeah.
Thanks. And then the second is to piggyback off the piggyback. The password managers, are those, like, how do we know what ones are safe to use, and then do they cost, are they expensive to use?
Most of them are free. I don't know about the licensing for Bitwarden. So he uses Bitwarden, I use LastPass. They have pros and cons like anything. You want to talk about Bitwarden?
So I like Bitwarden because it's open source. That means people like him and I can go in there or look at the code. We could develop exploits for it, report that. Whereas LastPass it's closed off. So
closed source,
that's kind of why I'm more for the open source free solution. But yeah, so if one of these gets hacked, it's still going to be bad. But I think I'm.
Well, to be fair, like with security, and one of the reasons that I do trust LastPass and I like them personally is because they, I think 3 or 4 years ago, they actually did have a breach, but because of the algorithms they were using to encrypt the actual master passwords, they were unrecoverable. So even if they posted those things online, it'd be technically infeasible to recover them. And there's a lot of technical underpinnings to that and why I thought that was the way to go. But their licensing, you do have to pay for it now. So I think it's like $7 a month is what we pay for the family or something like that. It's and that's for the family account. So me and my wife both have it. We can share it with our children as well, so they can be using it. We have like family passwords for like the Hulu or the Disney Plus that we can share with everybody. So it does make sharing passwords securely a lot easier. But to answer your question, I guess, as a whole, those are just our choices. Yeah. If you look at password managers, there are a lot of comparisons online, and most of them are just fine. I don't know if there's any one I would say like, oh, don't do that.
They all do the same thing.
Yeah, like one password I mentioned, Dashlane is another one. Oh gosh, yeah, there's 5 or 6 in that area, but you should be fine with any of them. The more important thing is to do the password hygiene that goes along with it, honestly.
Any other questions? Oh, Jocelyn, I'm coming.
And if we don't get to all the questions, we'll still hang out. We'll be around. So if you guys want to
He has to follow me, guys. So
talk about anything, or if you want Heath to scare you by looking at what passwords we can see in data breaches online, we can do that and talk about it.
This may be out of your scope, but like I have a electronic lock to like my house where I have a code for it and stuff. So if they hacked my phone, they could technically get that too. Would that be something?
Maybe.
Without seeing the app, I guess.
Yeah, it'd be hard to say with the app. So a lot of those apps have like APIs they communicate with, and there's some exposure there. Yeah. But like hacking your phone doesn't really happen that easily or that often, I would argue. There's a lot of reasons for that, but like unless you're like a nation state level target, like if you're a political figure,
yes.
If you're a journalist, if you are a celebrity, then you definitely have to worry about those things. But for the everyday person, your phone isn't really a target, and there's a lot of reasons for that, but it wouldn't keep me up at night. I can open my garage door from my phone right now. So,
me too.
Yeah.
Thank you.
Mm.
All right, I'm going to cut them off. I know they could go on forever. So thank you, Heath. Thank you, JR, for scaring all of us.
Thank you guys.
Appreciate it.